Hello everyone, this is Bill, as you can tell. I am going to do my presentation via my flip camera because I was the one who suggested maybe we should try this, and so I felt like I'd be kind of a hypocrite if I said let's put it online or let's use technology and not do it. So bear with me, this is the first time I've ever tried anything like this, so I will do my best to make sense, and yeah, so I'm going to go over my BIP and my FDA stuff. So I believe the first thing Carla and Carl wanted us to talk about was kind of an overview of the child. So, and if I look to my left, which is going to be your guys' right, I think, I got my computer over there so I can see what I wrote. So I'll try to keep eye contact with the camera, but it's hard because it's very impersonal and it doesn't smile at me. My student's name was Rochelle. I did my interview on November the 4th. Rochelle's about 4 years old. She's 4 years, 7 months, female, obviously. The target behaviors that I was looking at is she was having a lot of problems with tantruming. She lays on the floor, she cries, she screams. It happens about 2 to 3 days, about 2 times a week. 2 to 3 days a week, 2 to 3 times a week. 2 to 3 times a day. 2 times a week, sorry. Lasts anywhere from 30 seconds to 3 minutes long. The intensity is medium. She's not injuring herself, but she's being very abrupt and kind of disrupting the flow of class. The other behavior we looked at was her punching and her hitting. She sometimes hits the teachers, hits the peers, more the peers than the teacher. It usually happens maybe once a day, once every 2 days, and once every week. So basically once a week she hits a student is what I'm trying to say. How long? She only hits them once or twice. It's not like Jack Johnson going at someone in a boxing match. It's just one punch. The intensity is low, is what the teacher that I worked with said. She's not doing anything that draws blood or anything. It's just a hit. So obviously she can't be doing that though. So she wasn't on any medication. She didn't have any medical complications. There were no sleep cycle problems. The eating, Anne, which by the way, these are all pseudonyms made up from my brain. I know you guys love my names I make up. So the child does not have any strange diet practices. She said she eats pretty normal. Describe the extent. Basically what they thought about, or what Anne, the teacher, thought about the behaviors is that they usually happen when someone tries to take a toy from her or they try to end free time. She has a temper tantrum if a child tries to take a toy, or she's not willing to give up a toy that one of her peers has or wants from her, is usually when the tantrum occurs, or the hitting and punching. Usually the tantrum happens, or the hitting and punching. The hitting and punching much less. It's kind of a way to really stop kids from taking the toys is what we kind of hypothesize. The behaviors are most likely to happen with teachers and peers, least likely to happen by herself. The activities are most likely to happen when putting away toys, changing activities, peer tries to take a toy. During times when she is not playing with toys, they happen very rarely. During transitions, like I said, asking her to clean up is when the tantrums really happen, trying to take the toy from her. What one thing could you do that would most likely make the challenging behavior occur? Take the toys away. Letting her play usually stops them. Let's see. The child's play abilities were pretty normal. She likes to play with toys. She doesn't play with other children a lot, from what Anne told me and from what I observed in my 2 observations. And I think that has to do with the fact that she's hitting her peers. I wouldn't want to play with one of my peers if they were hitting me. So how does your child react if you ask him or her to stop playing with a toy and switch to a different toy? She tantrums and hits. So identifying the function of the behavior, we decided that the tantruming was to avoid having toys taken away. Hitting is to avoid having toys taken away, and tantruming, she avoids, she gets what she wants or she avoids. So tantruming serves 2 functions. to avoid something, and it's also to get toys if she can't have them, where the hitting is mainly, if she wants something from someone or someone tries to take something. So, are there any of the above behaviors that are more or less likely unaffected if you present her with a difficult task? She'll tantrum if you ask her to do something she isn't confident she can do. And I think that's pretty much all I had for that. I think that describes it really well. Okay, so on to my behavior intervention plan. So we decided it was a skill deficit. She just doesn't have the words necessary to say, can I have that toy? I'm not ready to be done with this. We thought maybe as it goes along, if she does get the words and she continues, then maybe it's a different deficit. But right now, we kind of decided that it probably is because she doesn't have the words and she's getting frustrated. So she's not super vocal. She's not super verbal. Alternative or replacement skills. So does she have the alternative or replacement behavior? Has it been observed? No. We can't really, we didn't really think that we were able to reinforce the behavior, so we were going to have to train it. One of our goals was in 6 weeks, when a request to take an object from Rochelle is made, Rochelle will respond by verbally denying requests or giving the toy to the requester 80% of the time. In 6 weeks, when Rochelle wants an object, she will request the object verbally or by hand gesture. So some of the prevention strategies, during times when there's when a transition is about to occur, we will give the student 5 minutes warning. So basically, how we developed some of our goals and how we were going to deal with the transitions is we looked at the behavioral analysis we did, and we realized that she must be participating in some of these behaviors because the transitions aren't set up well. So we used the FBA to inform the BIP, which is one of the things that I believe Carla wanted us to address. So we found the function of the behavior and we addressed it in the intervention. We're going to teach alternative and replacement behaviors. We're going to show Rochelle the I Can Use My Words social stories from the CEPL website, which shows kids how to use their words, basically, essentially. And we think that will be really helpful. She's going to get it modeled for her. Anne's going to model it for her. They're going to work with their students. They're going to get rewards. This looks, Carla, I know you're probably shaking your head. This looks very much like my 555 project because a lot of the same issues were involved in that. So I thought it seemed like a very workable strategy, so that's what I went with. Let's see, response strategies. If Rochelle uses her words, she's going to get rewarded. If Rochelle acts up, becomes injurious to her peers, she'll be removed until she settles down. It's all in the behavior intervention plan. Monitoring, we're going to use the count system where Anne wears a piece of tape on each wrist. If she tantrums, she'll mark it on her left wrist. If she hits someone, she'll mark it on her right wrist. And that'll be how she monitors if the behavior is going up or down. As far as implementation, we'll make sure that her and I met. We decided that if we really were going to do this, I would come back, watch her, see if she was actually implementing it well, so we had inter-rater reliability. And that's it, I believe. Also, what other info did I use to do this? 555, which is Carla's topics in early childhood special ed. If anyone's looking for a class, feel free to take it. There was a lot of good information in that. The CEPL website where I can use my words slides. Also, Nancy and Lisa, my office mates, obviously we bounce ideas off of each other, so it was good to have them as a resource. And then other relevant intervention variables. Well, Anne has a bachelor's degree, so she's obviously educated and able to do some stuff that a typical daycare provider might not be able to. And then Anne's really busy, so we couldn't do a lot of intervention stuff, and her helper actually just recently left, so that was an issue. So that is it. Thank you for watching. I'm under my 10-minute mark by about 20 seconds, so have a Merry Christmas, and I'll see you guys after the break. Bye-bye.